So next is infection of the liver. The most important infection of the liver, which you will see in the hospital or on your exam, is ascending cholangitis. It's very important. It's a life-threatening infection of the liver. Ascending cholangitis. It's a triad of fever, jaundice, right upper quadrant pain. So we have gallbladder, you have liver, then common bile duct. So let's say there is a stone, there is a tumor in this area that will result in stasis. So this stasis will cause the bile to accumulate here, and the bacteria can attack and can cause infection, which will result in fever, jaundice, and right upper quadrant pain. It requires decompression and drainage. So while the patient is in the hospital, you will be putting those patients on Zosyn, piperacillin, and tazobactam. So granulomatous hepatitis and spontaneous peritonitis you will not see on the exam. It's not very common. Centrilobular hemorrhagic necrosis. Is also called nutmeg liver. So let's say someone has severe heart failure. There is this backing up of fluid into the lung and then back into the liver. So that will result in congestion of central vein, which will result in necrosis of hepatocyte around the central vein. So this is hepatic lobule, there is a central vein, and then the hepatocyte which are present around the central vein will be damaged because this area is already prone to ischemia. This is called nutmeg liver. So clinically these patients will have painful hepatomegaly, and AST, ALT will be elevated. So sometimes it is also called cardiac cirrhosis because it is happening because of the heart failure. So post-hepatic obstruction to blood flow. So obstruction to blood flow caused by outside the liver causes a hepatic vein thrombosis and veno-occlusive disease. I think we already discussed about this. Hepatic vein thrombosis. So common cause is polycythemia vera, hypercoagulable state, hepatocellular carcinoma by invading hepatic vein. Veno-occlusive disease, complication of bone marrow transplant, collagen develop around central vein. Liver abscess, commonly caused by gram-negative organism, E. coli, and anaerobes, bacterioids, enterococcus. So these patients will have right upper quadrant liver pain, and when you do the exam, LFTs, their AST, ALT will be very high, and they will have signs of sepsis. Signs of sepsis. What are the signs of sepsis? Fever, low blood pressure, tachycardic, their WBC will be elevated. So when you do, because the liver enzymes are high, you will do the ultrasound of the liver, and then you will see the abscess in the liver. So treatment is percutaneous drainage, and then you have to give them antibiotic. You have to cover gram-negative organism with ceftriaxone, and for anaerobic coverage, you can use flagyl, metronidazole. This is solitary liver abscess. It requires percutaneous drainage plus antibiotic. This is on the CT scan. Next infection is leptospirosis. It is caused by Leptospirosis interrogans. It's gram-negative organism, spirochetes. Reservoir stays in cats and dog. Transmission is swimming in contaminated water. It's biphasic disease, also called wheel disease. So this is the transmission. So rat bite. So they will give you a warehouse. They'll give you a question in which old warehouse is open and you were cleaning, and because old warehouses have rats and their feces and urine can be there, so you are cleaning, and sometimes if there is a rat bite, that will result in transmission. So you can have the symptom will be rash, headache, vomiting, high grade fever, abdominal pain, red eyes. Okay, this is the clue you will be using. Aches and pains in the muscle, and a lot of chills with diarrhea. So like I said, it's a biphasic stage. First stage, the patient will be septicemic. Septic, the patient will be septic. And they can have fever, jaundice, hemorrhagic diathesis, renal failure, conjunctivitis, and meningitis. And then once they develop the immune phase, presence of numerous organisms in urine, which is examined by microscopy. Diagnosis is based on serology, and treatment is penicillin G. But in the clinical situation, in the clinical question, you will look at the warehouse or old house, cleaning the house, or rat bite, rodent bite. These are all the clues. Amoebiasis caused by ant amoeba histolytica. It is the most common cause of liver abscess worldwide. Commonly involve right lobe of the liver, and the treatment is flagell followed by paromomycin. So on imaging, you will see multiple abscesses in the liver. These are all the abscesses. So you will be getting CT scan with contrast. You can also get MRI, and here you can see multiple abscess. It's big abscess. Wow. Clonorchis. So it's caused by Clonorchis sinensis infection. It's a Chinese liver fluke infection. It's contracted by ingestion of larvae in the fish, especially uncooked fish. So the larva will enter the common bile duct and grow there, become an adult. And the most common question they will ask you that if this larva stay in the common bile duct for a long time, what is a complication? It can cause cholangiosarcoma. Treatment is praziquantel. It's antiparasitic, which can get rid of Clonorchis sinensis. Cholangiocarcinoma is the most common complication. So what is the life cycle of Chinese liver fluke? So basically starts with so you took the fish, so eat the fish which is not cooked, and then it grow into the human being, go to the liver, and from the liver, from the human being, it can go back into the stool, back to the egg phase. Egg go back into the water, and then from water there will be larva, and then fish ingest those larvae again, and that's how the cycle continues. Next is schistosomiasis. It's caused by schistosomiasis mansoni. So this larva will be present in superior mesenteric vein, which enter into portal vein, and from the portal vein they become adult worm. These adult worm, they lay egg, which initiate inflammatory response, causing concentric fibrosis and pipe stream cirrhosis in vessel wall. What are the complications? Cirrhosis, portal hypertension, and ascites. Treatment is again praziquantel. So life cycle of schistosomiasis mansoni, you don't have to go through this. So there are different types of schistosoma. So there is present in water. Different types are schistosoma mansoni, schistosoma japonicum, and then schistosoma hematobium. So where they come from the feces and the urine. So these, so they lay eggs, and the eggs they hatch in the water. So initially there will be microcedia, and these microcedia they grow, and then they form, eaten by snails. Microcedia are eaten by snails, and these snails, inside the snail they form schistocytes, sporocytes. They form spores, and then they are released back into the water and form larvae, which can penetrate the skin of the human being when they are swimming. And from the skin they enter the human being, enter the circulation, enter the portal vein, and in the portal vein they will cause complication like cirrhosis. Okay. Echinococcus granulosus is caused by Echinococcus granulosus. Sheffer disease is also called intestinal tapeworm disease. You will see multiple or single cyst containing larval form, and the rupture of the cyst will produce anaphylaxis. Treatment is percutaneous drainage plus albendazole. So it's also called hydrated cyst of the liver. So in the liver, when you do the ultrasound or the CT scan, you will see large cyst which has multiple small cysts. So rupture of these cysts can cause anaphylaxis. So the diagnosis will be made on imaging, and they will give you the imaging in exam. Neonatal hepatitis. So it is associated with congenital infection like cytomegalovirus infection, sometimes because of inborn error of metabolism like alpha-1 antitrypsin deficiency. Biopsy will show multinucleated giant cell in the liver. It's also called giant cell hepatitis. It's not very common. They will not ask you commonly about neonatal hepatitis. Reese syndrome. So it results from treatment of viral fever in child less than 4 years of age, and they can ask you about this in the exam. What happens is aspirin metabolites decrease beta oxidation of fatty acid by causing reversible inhibition of liver enzymes. It's a triad of, so child will be listless, encephalopathic, altered mental status, plus elevation of AST, ALT, and then when you do the ultrasound of the liver, you will see fatty changes. So patient will 100% have a history of aspirin use with recent upper respiratory tract infection. So that's a clue to the diagnosis. So clinical finding: patient child will be lethargic, sleepy, tired, vomiting, hepatomegaly because of liver dysfunction, encephalopathic with cerebral edema, raised intracranial pressure. It can even lead to death. because of raised intracranial pressure. Lab finding AST, ALT will be elevated. Bilirubin can be elevated. Because liver is not functioning, ammonia level will be high. If there is a liver failure, PT can be high. Treatment is supportive. If raised intracranial pressure, then you can use mannitol, hyperventilation. Avoid aspirin in children, except in the case of Kawasaki disease. If Kawasaki disease is confirmed, because Kawasaki disease has increased risk of coronary artery disease. So that's the only indication when you can use aspirin in kids. Otherwise, try to avoid. Next is autoimmune hepatitis. So autoimmune hepatitis, hepatitis panel will be negative. These patients will present with elevated liver enzymes. AST, ALT will be elevated. And when you do further testing, they will have positive ANA, positive anti-smooth muscle antibody. So that's the clue to the diagnosis. Because it is autoimmune, these patients can have a history of other autoimmune diseases like type 1 diabetes, thyroiditis, Graves' disease. They can have HLA association with DR3, DR4, more common in female. So treatment is steroid and azathioprine. Next is acute fatty liver of pregnancy. During pregnancy, beta oxidation of fat can be abnormal. So this is usually resolved after pregnancy. This is not like an important topic for the exam. Let's move on to preeclampsia. Preeclampsia, you can get a question, especially with HELP syndrome. So what is preeclampsia? It's a triad of hypertension, proteinuria, and pitting edema. Hypertension, proteinuria, and pitting edema in third trimester of pregnancy. Liver cell necrosis around portal triad can happen, increase AST, ALT. What is HELP syndrome? Hemolysis, elevated liver enzyme. So these two, elevated liver. And then LP is low platelet. Hemolysis result in anemia, elevated liver enzymes with cystocytes on microscopy, and then LP is low platelets. This is HELP syndrome, which is a complication of preeclampsia. What is alcoholic liver disease? So alcohol can cause hepatic steatosis, fatty changes in the liver, because alcohol will result in increased production of triglyceride. So it results in macrovascular fatty changes. This disease is reversible with cessation of alcohol. So healthy liver, patient continue to drink. Hepatic steatosis. If continue to drink, steatohepatitis. So at this point, this is all reversible if they stop drinking, but if not, then it converts into liver cirrhosis which is not reversible. So this is normal liver and this is fatty liver. You can actually get this image, histology, in the exam. Not the gross one, but this one. So these are the fatty changes in the liver, fat cells. Alcoholic hepatitis, it happened because of chronic alcohol use. Ethanol, which is alcohol, converts into acetaldehyde, which damage hepatocyte. So the hepatic cells will be swollen, necrotic, and they will have neutrophilic infiltration. Liver will have Mallory bodies, which is the accumulation of damaged cytokeratin intermediary filament in hepatocyte. They can have fibrosis, their AST will be greater than ALT, GGT can be elevated, and the complication is liver cirrhosis. What is GGT? Gamma glutamyl transferase. They can be elevated. So these are the swollen hepatic necrotic hepatocyte with neutrophilic infiltration. So in blue, these are the neutrophil which are infiltrated, and then these white, these are hepatocyte fat cells. Again, the same image. The final complication of chronic liver disease due to alcohol is alcoholic cirrhosis. So you will see sclerosis around the vein, and then regenerative nodules surrounding bifibrous band in response to chronic liver injury. It can also cause portal hypertension. So this is liver cirrhosis. Multiple nodule on gross examination. Normal. Non-alcoholic fatty liver disease. It's also called NAFLD. It is caused by metabolic syndrome, which is a combination of hypertension, hyperlipidemia, obesity, insulin resistance, NAFLD, which will result in fatty infiltration of hepatocyte, causing ballooning and necrosis of hepatocyte. It can cause cirrhosis and hepatocellular carcinoma. So normally in alcoholic liver disease, AST is greater than ALT. But in NAFLD, non-alcoholic fatty liver disease, ALT is opposite. ALT, alkaline phosphatase, is greater than AST. So incidental diagnosis. So a lot of time we do ultrasound, and patient will not have any history of liver cirrhosis or alcohol, but they will have fatty infiltration of the liver. Drugs and chemical induced liver injury. So the different tumors which can cause liver injury: angiosarcoma associated with vinyl chloride, arsenic, thorium dioxide; cholangiocarcinoma, thorium dioxide, radioactive contrast media; hepatocellular carcinoma is most important, vinyl chloride alpha toxin; liver cell adenoma associated with oral contraceptive pills. So we already discussed acute hepatitis, cholestasis. So drugs causing fatty change: amiodarone, methotrexate. Fibrosis can be caused by methotrexate, vitamin A, amiodarone. Acute hepatitis can be caused by Tylenol. Don't forget that. Very, very important. And the other drug which can cause acute hepatitis is halothane, which is used for anesthesia. Isoniazid for TB, very important, can cause acute hepatitis. Methyl dopa, not very common, but it can cause acute hepatitis. Cholestasis, OCP and anabolic steroid can cause cholestasis. So for acute hepatitis drug and cholestatic drug, they are both very important.